We're grateful to have so many folks tuning in from across the US who care about this issue. We have farmers, impacted community members, animal welfare groups, environmental justice groups, environmental groups, worker justice groups, public health professionals, academics, media, and other interested audience members joining today. This topic touches many, and this is only a portion of us. And we do also want to take a moment to lift up in our thoughts those in the Southeast who are still dealing with so many of the devastating aftermaths of the recent storms. But we do see you all across the country. We know many of you, and we're appreciative that you are here and engaged in this issue. So a little bit about SRAP before we get into the discussion. SRAP collaborates with communities to protect public health, environmental quality, and local economies from the damaging impacts of the industrial livestock system, and to advocate for a socially responsible food future. We do this through education, advocacy, and organizing. We have 4 programs, including our community support program, our Water Rangers, which is a water monitoring program, the Contract Grower Transition Program, and the Food and Farm Network, through which we support advocacy, network building, and educational opportunities like this webinar today. So today we are discussing highly pathogenic avian influenza, also known as bird flu, also known as H5N1. The communities we support are often concerned about negative health impacts from living near concentrated animal feeding operations for reasons such as this virus. So we wanted to bring this discussion together to share more information about what is happening with the virus, specifically after the crossover to dairy herds. And as we considered this conversation, we realized there are so many important perspectives that need to be brought to the table. So we pulled up several more chairs. As you've noticed, this is a large panel, and we have many incredible voices here. I know that there are many others out there working on this issue that could also have been included. But we want to try to do 3 things today. First, we want to share information. We feel there have been some major gaps in communication and transparency, particularly for the communities and farm workers who have been most directly impacted by the industrial livestock system. We want to understand authority, responsibility, and opportunities to improve the current response for the animals, for impacted communities, and for the environment. We also want to better understand what this means for public health, what's the risk, and particularly how can we help advocate, or how can we collaborate for better protections or precautions for farm workers, farmers, those who are currently facing that direct risk. So I think we are ready now to turn it over to our panelists. Thank you all so much for being here today. I would like to give each of you just a minute or so to give us a few sentences about why you're here and through what lens you are focused on this issue. And I'm going to actually start with Meghan Davis. Meghan, would you start us off?
Sure. Great to be here. Bienvenidos. I'm an associate professor in environmental health and engineering at Johns Hopkins Bloomberg School of Public Health. I'm here for 2 main reasons. The first is I wear a hat as one of the 2 directors of the National Institutes of Occupational Safety and Health at Johns Hopkins, the Poe Center. We're focused on the interface between what you might call occupational safety and health, which is protecting workers, and also promotion of worker well-being. So it's in that role that I really try to advocate for not just worker health and protection, but also how to make work a livable, great place to be. I'm also here because I am a veterinarian. I actually trained in California and practiced in Pennsylvania. And a lot of my practice career initially was focused on dairy and rural practice. So I've been on the ground on farms like the ones that are being affected by this outbreak, not just in terms of the dairy, but also poultry and swine.
Thank you so much, Meghan. Bethany?
Hi, everyone. My name is Bethany Alcauter. I work at the National Center for Farmworker Health. I'm an occupational epidemiologist and labor advocate, and I'm really lucky that my job combines those two things. We do a lot of capacity building work with farm workers serving organizations, with farm workers directly, with producers, and with governmental agencies as well.
Thank you. Chris?
Hi, everyone. It's good to be here. I'm Chris Heaney, and similar to Dr. Meghan Davis, I like that I wear two hats. Sometimes I feel like it's many more, but there's two hats relevant for today. As Dr. Davis mentioned, I lead an occupational and epidemiology in terms of biomarkers and how they can be useful for improving understanding of worker health and safety concerns, particularly around things that are infectious diseases, agents, pathogens. And that connects to the second hat, which is the ways in which we think about designing these biomarkers, which traditionally have required blood, or perhaps at the beginning of the pandemic, many of us remember the nasopharyngeal swab and what that felt like. So the biomarkers that we try to develop, we try to design them to be less invasive and ultimately try to use things like saliva that can be collected across the life course among the very young, healthy workers, and also the elderly. And so those techniques trying to tear down barriers to information without compromising rigor or quality are part of my work in the Community Science Initiative for Environmental Justice, which is partnership work with fence line, frontline workers at industrial food animal production facilities and also neighbors of those facilities. Really happy to be here today.
Thank you. Let's see, Anna?
Good morning. Thank you for having me. And my name is Anna Schultz. I am the Regional Director of Project Protect Promotora Network, which is a branch of Project Protect Food Systems. We provide assistance to agricultural workers. In my area is Northern Colorado, which encompasses Weld County and Larimer County. Why I'm here is because through the generous funding of NCFH, we have been able to do outreach and provide education and protective gear to dairy workers in the area. And we've learned a lot through their testimonies. And that's it. Thank you.
Thank you for being here. Ben?
Hello, everybody. It's a pleasure to be with you all today. My name is Ben Rankin. I am an attorney at the Center for Biological Diversity, where I work in the environmental health program, and my work focuses on controlling pollutants that go into the environment and cause negative impacts for wildlife. My organization, the Center for Biological Diversity's mission is to ensure a livable future for all species, great and small. The environmental health program and my work in particular focuses largely on impacts of industrial agriculture, and especially industrial animal agriculture. And relevant to this context, pathogens and infectious diseases that are associated with animal agriculture. So we have been advocating for a strong response to avian influenza, and I would love to offer our perspective to this conversation, especially as it relates to the relationship of this virus to wildlife.
Thank you for being here, Ben. Carla, would you like to introduce yourself?
Sí, hola a todos. Mi nombre es Carla Martínez. Yo pertenezco a Project Protect Food System. Mi directora está aquí, ella es Ana. Mi trabajo consiste directamente con el trabajador agrícola. Tratamos de mantenerlos informados acerca de todo lo que está pasando referente a su trabajo en las lecherías, en el campo, a mantenerse seguros con el calor. Ahora con lo de la gripe aviar, los estamos informando, les llevamos flyers, les llevamos protección para que usen usen durante su trabajo y pues ese es realmente mi trabajo directamente con el trabajador.
Thank you. And Craig.
I'm a former CAFO owner, operator actually here for 23 and a half years. For the last several years, I've worked with Ashton at the Socially Responsible Agriculture Project. I'm now director of the contract grower transition program. The reason I'm here, I guess, is the kind of concerns, well, how the industry got where it is and maybe where it's going forward. Also, I have an insider perspective. I've been boots on the ground concerns I have for individual farmers, the workers on those farms, and as well as just the community in general.
Thank you so much, everyone. Okay, let's dive into kind of this first segment. And I'm not sure if I let the audience know, but we do have a full hour and a half planned. So we may do this discussion until the top of the hour and then allow that last 30 minutes for question and answer. So the first thing I hope that we can unpack today is just more explanation of what is avian influenza, what specifically is this H5N1, help us understand more of what this is, how it has changed over time, and what we're facing today. And I think Meghan and Bethany and Ben will kind of help us with this first segment, but please, as other panelists have thoughts, you can feel free to, I'm not sure if you can raise your hand as a panelist, we'll try it. But let's start with Meghan.
Great, thanks so much. And it's wonderful to be here. I've been asked to set the stage in part because of the importance of animal health to this particular outbreak and to what we think about with avian influenza viruses writ large. So avian influenza, or highly pathogenic avian influenza, that we sometimes as veterinarians might call high path, because it's different from low path, meaning it's worse for the animals, has been around for a really long time. Anyone who has backyard poultry or who's run a big commercial poultry production facility, I think recognizes that it's one of the ones that we really worry about, because when we have outbreaks, it has really high mortality. So it can affect a large number of the birds, and there are pretty aggressive programs through the United States Department of Agriculture to help control the spread of high path, or HPAI. What we're dealing with H5N1, which is a particular strain of this bird flu or avian influenza, is something a bit different in terms of scale than what we have seen in the past decades. So this originally came to North America in late 2021. It affected Canada first briefly, and then immediately got into the US wild bird and domestic poultry production facilities, causing a lot of deaths. And it also was detected in mammals. And that, from the perspective of someone who does health security and public health, is a concern, because when you have movement from a bird to a mammal, that means, this virus has the potential to get into other mammals like humans. And we have seen that avian influenza, these highly pathogenic avian influenza strains, do affect worker populations globally. It's something that we see often sporadically and with variable kinds of disease. So sometimes more mild, as we see in this particular case of H5N1, but often in other strains and in other countries, occasionally quite lethal. So that's part of why we see that the public health response has been, of concern for humans, but also of concern from more of an ecosystem perspective, of the damage that it does, not just within our wild bird populations, but also within these other mammal populations. And you may have heard about the devastating deaths in marine mammals that we've seen in South America and elsewhere, and also the devastation that we can see within other species, such as cats. And this can include domestic cats, as well as the cats that we, have in zoos, so our tigers, etc., that are, really part of these big conservation programs and are really of high, concern in terms of their conservation status. What we also recognize is that H5N1 does behave in some ways like a traditional avian influenza. The reservoir are these waterfowl. So these are birds like ducks that often are also migratory. And so as you can imagine, if they come to a pond, they might poop in the pond, and that's how they transmit it to these other birds. We're not exactly sure, although we suspect that the spillover, which is, the transition from this wild bird population into the dairy cows, happened in late 2023 and may have involved wild bird exposure, but we're not 100% sure of that. What we do recognize is that it's been the same strain in the dairy cows moving around. So we don't have necessarily multiple events of spillover. It was one spillover event, and now it's transmission from one cow to the next, often through milking equipment. And the milk itself is the most infectious that we see in terms of the kinds of exposures that workers have. It's part of why the dairy workers, and I've been on a lot of dairy farms, and the milking machines are here, right? Because you're in a milking parlor that is recessed, is down lower than where the cows often are, and you're putting that milking equipment on, and so splash from the milk is one way that we see the workers getting a lot of the eye symptoms. What we see in the poultry workers is a little bit different, because in those situations, you have the birds moving around, kicking up the virus that's on the litter into the air. And so you tend to see more respiratory symptoms, although there's certainly a whole suite of possible symptoms. You can have these respiratory symptoms, but it may also be possible to have other kinds of symptoms. We know in the cows that in addition to symptoms in the milk, so the milk looks bad, it looks like mastitis, you also can have symptoms in the gastrointestinal tract, so you can see some diarrhea. And we know in cats on the farms, it's highly lethal, and that we also see neurologic disease. I think the biggest concern that we've seen recently is that this is something that, despite the restrictions on movement of cows from one farm to another across state lines, we do see a new outbreak in California that is spreading along what we think are probably both lines of proximity, so farms close to each other, as well as some of these other routes of transmission that the USDA, the United States Department of Agriculture, has identified as potential routes of risk. And those would be shared equipment and shared personnel between and among farms. And what we've seen there is that in the last, I think, 30 days or so, we've gone from about 15 people and about 200 herds affected to 20 people, 19 of which are associated with farms, and 300 herds affected. So this means that even though we've had lots of containment efforts, we're still struggling to make sure that we are preventing the virus that is specific to the dairy cow. So this is a particular strain of H5N1 from spreading further. And I think it's probably time to turn this over to my esteemed colleagues to go deeper onto some of these issues.
Thank you so much for that. Yeah, let's pass to Bethany for a minute, and then we will check in with Ben to see what he would add.
I'll be brief. Megan did a great overview. The only things I would add that we're seeing, and we've been doing a lot of focus groups with farm workers, as well as talking to our colleagues at the organizations we partner with to do outreach and education to dairy workers, is number one, there's a real breakdown in communication. Dairy workers, if they're told anything, it's usually that they need to be careful because they can get the cows sick. There's very little happening in terms of telling workers that the cows can get them sick or the chickens can get them sick. And there's just not much around what the disease is, why it's a public health concern, etc. The second point I would add is that dairy workers are sick a lot. There's a lot of dust, there's a lot of feces, there's, bovine tuberculosis and other infectious diseases that have plagued dairy workers for a long time. And so there's some logical thought processes, I would say, with perhaps producers and certainly with workers, is that our health is always a problem because of our job. So like, why does it matter now? So there's more work to do there just because we have, as a society, kind of neglected their health for a really long time. And then the third point that bothers me about this whole thing, and it's something we see in agriculture more broadly, but especially in dairy, and I'm increasingly learning in poultry as well, is that these industries are really dominated by a workforce that is indigenous, that is native. So they're from native communities in Mexico and Guatemala. A lot of times they don't speak Spanish fluently or English. They speak a pre-Columbian language. And there's just a lot we owe these folks already. And it's troublesome that education isn't happening and that really almost nothing is happening in the language that many of these workers prefer.
Wow, great points, Bethany. I think we want to come back to some of that later in the discussion. So thank you for raising that. Ben, I'm going to let you add to this overview, but also just to let you know where we're going kind of with our next segment is about the structural response. What is kind of the agency response? So if you want to kind of lead into that as well, I'd welcome that.
First thing, I'll do my best. I think Megan and Bethany both gave an excellent overview, so I am struggling to find pieces to add, but there are a few things that I would point out. First of all, is the relationship of avian influenza to wild birds, right? As Megan correctly noted, migratory waterfowl are considered the natural reservoir of this virus, H5N1 avian influenza. But it's important to state the relationship between the virus's presence in wild birds and its presence in domestic bird operations, because its global transmission has been effectuated through a combination of both the migration of waterfowl along those migratory pathways and the global transmission of the virus through trade channels. I'll also state that these poultry operations tend to make the virus worse. So when we look at what avian influenza looks like in its natural reservoir populations, it tends to be fairly low path, right? Or low pathogenicity. But when we introduce the virus to poultry operations where birds live in unsanitary and highly confined conditions, the virus is kind of able to spread through them like wildfire. And those are so many more opportunities for the virus to mutate, to adapt to new kinds of hosts. And eventually, the virus spills back into the wild. And this creates this cycle or this loop of intensification and increasing pathogenicity. In fact, there was one meta-analysis that was done looking at 39 different events from 1959 to 2015, where they found that low path avian influenza went to being high path. And out of those 39, 37 of those events were associated with commercial poultry operations. So it's a very clear relationship between the increasing pathogenicity of this virus and its relationship with industrial animal raising. I'll also reiterate what Megan said about the danger that this virus poses to wild animal populations. It did kill tens of thousands of sea lions and seals in South America in 2023. And we've noticed that the virus is infecting more and more kinds of different species. In the United States alone, we've already observed it to infect more than 175 different bird species and 25 different wild mammal species. This includes really diverse groups of mammals. We've got grizzly bears, polar bears, all kinds of different foxes, panthers, raccoons, and skunks, but also even federally endangered and threatened species like Pacific fishers, right? So this is something that is increasingly infectious of mammals. And the concerning thing about the virus is that as it breaks into more kinds of species, it's able to recombine different adaptive traits and become better in the future at infecting novel hosts and adapting quickly to those. And then I'll also briefly just kind of try to give an impression of the scale of the virus's outbreak in recent years. As Meghan noted, there have been 300 dairy herd infections in the United States across 14 states, and that has had a huge increase recently. From October 3rd to October 11th, California went from having 56 infected dairy herds to having 100. So there's a really, really huge spike just in the last couple of weeks or even last week. And over the entire course of the outbreak, I believe that over 100 million poultry birds have been affected in the United States. So it's a really, really significant outbreak in terms of its scale. I'll segue maybe into some of our structural opportunities to address these concerns as they relate to our policy choices.
Yeah, we might, Ben, I realize we might really quickly, can I actually pass to Craig really quickly first? Because I realize that some folks might appreciate a bit more of a descriptor of what these poultry houses look like. Like, what is the scenario? What are we talking about when we talk about industrial livestock production? And of course, like we have seen it through poultry, but this year the jump to dairy herds was particularly alarming because that is another highly concentrated system. And you talked about trade. So Craig, can I ask you to just share a bit as a former contract poultry producer? Can you just give us a little bit of insight into kind of the conditions in the barns that he was talking about?
Yeah, I mean, so much of it goes back to the hyper consolidation of agriculture in general. And this is just one more thing, right? Generally, in my case, I had 4 barns. They were 40 feet wide by 500 feet long. That's not the status quo today. They're building barns that are 66 feet wide by 600 feet long, even longer in some instances. My particular farm in my era, 2 to 4 houses was normal. That's not a thing anymore. Just like the industry, the farms have gotten much larger and there are fewer farms. We see as many farms now as, well, I say farms that have 48 barns that are 66 by 600. That's 43 acres of chickens under a shelter and on probably about 50 acres. So it's and inside the houses, as has been mentioned, I mean, it's pretty miserable conditions once the birds get up to, halfway to market age. I mean, you've got dust flying, you've got feces flying, you've got ammonia issues. Your houses are probably solid walled up, meaning if you have a power failure and your generator doesn't kick on and bring those fans back on, and in about 45 minutes time, you're getting ready to have a bad day. And so just the general conditions of the farm, and then the bird itself. I mean, you're talking about the industry has basically set up the perfect petri dish for this thing to really explode. I mean, you've got the perfect host with a compromised immune system and nothing to stop it, right? So there are a lot of issues on that farm level for me as a farmer. I mean, I'm having to handle those dead birds, and I'm in that environment all the time, as well as the workers, and it's getting out in the community too. I mean, you got 43 acres of chickens under shelters. You probably got 500 or 600 fans blowing out in the community to the particulate matter and the ammonia and what. So, what could go wrong, right?
Thanks, Craig. Okay, Ben, I'll pass it back to
you. Specifically on the poultry houses, or are we switching over to?
Sure, sorry. Yeah, I can clarify. Yes, we can kind of switch gears now, but I think I'll express that from our work with community members. I know there is always this question of, I'm nervous about this. I see these things happening at the poultry farm or the dairy farm near me. Who is supposed to be in charge of this? Who do I talk to? How can I find out more information? So I'd like to take a bit to talk about what the response has been from agencies We can go further into gaps and opportunities in a little bit, but just generally, can folks provide a bit of an overview of what the response has been from agencies? And who's in charge? Who are we looking to?
I'd be happy to lay out my overview of this. So at the federal level, my understanding is basically that the response to this outbreak is being divided among 3 different agencies broadly. So the Centers for Disease Control and Prevention have been handling the response to human infections. They've been conducting worker testing and publishing updates on their website concerning the human outbreak. Next, USDA, the United States Department of Agriculture, has been handling the animal outbreak. And this has particularly been spearheaded by APHIS, or the Animal and Plant Health Inspection Service. And then in particular, the regulation of food products that might be contaminated with avian influenza, like milk or eggs, is being done by the FDA, the Food and Drug Administration. I can speak most specifically to USDA's activities in terms of the on-farm activities and what they're doing with respect to animal outbreaks on farms. So first of all, the way that USDA kind of, I think, conceives of the breakdown of responsibilities on this is that the federal agents or officials are generally providing guidance. They're providing oversight over APHIS or over HPAI response activities. They're providing oversight and resources. They rely on state and local authorities to take actions like issuing quarantines, restricting product movement, and then they rely on actual owners and producers to implement biosecurity measures and to carry out response efforts. So pre-outbreak, this involves the imposition of biosecurity measures, right? These are any tool that you can use to stop HPAI from being introduced to the animal operation and from spreading within it. These are any kind of device or a technology that prevents wild birds, for example, from having access to a facility, or these are approaches to maintain more sanitary facilities, right, that decrease disease spread if it does get in. And these also include having protocols to monitor for sick birds so that you can quickly respond if there is an indication of an outbreak. APHIS does a lot, is at least trying to really emphasize the biosecurity aspect of response and this preventative aspect. They're already doing reimbursement for dairy producers who implement biosecurity protocols, and they're currently working on implementing the same kinds of biosecurity reimbursements for poultry producers who have to depopulate and dispose their infected flocks. So response on the ground, right? After we do have an outbreak in a facility, the way we respond to it depends on what kind of facility it is. So for poultry facilities, this generally involves depopulation and disposal of birds. And that's a nice way of saying that they kill all of the birds, basically, that are considered to be part of the infected flock. This is obviously a hugely difficult process. It may sound simple to say that you cull all the birds at a commercial poultry facility, but in reality, there are tens of thousands to even millions of animals, and this problem can be compounded when you have multiple facilities that are clustered together in one region that experiences a shared outbreak. So it can be a massive undertaking to kill these huge numbers of birds, to transport their carcasses for disposal, which is usually, disposal usually involves either composting the birds, supposedly indoors most of the time, but they also will bury them. Sometimes they'll render them, they'll incinerate them or put them in landfills. And then another part of this poultry response is just disinfecting the facilities, right, that have these huge quantities of pathogens on them from all of the activities that have been taking place to respond to this outbreak. I'll note at this point that the poultry depopulation activities are a huge nexus at which workers can become infected. I think out of the 19 workers who've been infected from animal or livestock exposure in the United States in this outbreak, about half of those have been poultry workers. And a lot of those poultry infections have been folks doing the after the fact depopulation and disposal. And around the other half of the infected workers are associated with dairy cattle. So to dairy cattle, what happens when a dairy cattle facility is infected? Obviously, they aren't doing the same kinds of depopulation that you might do for a poultry facility for large animals like cattle, often which might suffer less mortality, right, associated with an infection. So generally, the approach to dairy cattle has been to emphasize testing, treatment, and containment. And USDA provides a lot of resources to producers who, both before they have an infection on their facility and after. So USDA is giving out money for facilities to implement biosecurity and testing. Facilities before they get an infection get money for sample collection. And once you do know that you have an infection on your facility, you qualify for additional funds and veterinary support, PPE, personal protective equipment, contaminated milk disposal, and there's even a financial offset for milk losses. There are concerns, obviously, for workers associated with these response activities, as we've noted that people have gotten sick while conducting them, but these are also concerning if they're implemented poorly for wildlife. Not only can these activities take place in sensitive habitats for wildlife, if we are, for example, going out into some critical habitat and burying a bunch of infected poultry carcasses, but also when we conduct these activities, we allow for significant leaching of pathogens into the environment if it's done improperly, both by leaving huge piles of carcasses out in the open while we're trying to process and manage the massive number of animals that we're having to dispose of, and because of when we're cleaning these facilities after the hand, we're actually producing a large, substantial amount of chemical contaminated and pathogen contaminated runoff that has to be contained. And so I'll maybe bookend my overview of the overall response structure there, and I'll let other folks add on to it as they think is important.
Thank you so much. And you raised a lot of really good things there. Craig, if we have time, I want to come back to you and get your perspective on that on-farm response. But since we're getting along on timing, I want to pass to Chris and then to Anna and Carla, because Ben described some agency responses for farm workers, and I'm curious from your perspective, and even Bethany, if you want to weigh in after. But Chris, you haven't had a chance to share yet, and so I want to see how you're responding to this. Also, I would love to hear too about the public health response to this outbreak. Are public health agencies concerned in responding?
Sure, thanks for that. And I think one of the things that is important to keep in mind is, and it comes from about over a decade of doing epidemiologic research studies in partnership with community organizations in Duplin County, Sampson County, North Carolina, and also on the eastern shore of the Delmarva Peninsula, and spending time with the workers and the neighbors. And when you start to understand that they have a lot of questions about health hazards and risks from where they live in proximity to concentrated animal feeding operations, and also if they have family members or they themselves work at an industrial livestock operation, be it a production facility growing live animals or a processing facility that processes animals into meat products. Or it could be, I think as we heard, the whole structure of the food system is when you have a need, when you have mortality among herds of a small scale or massive scale, there are workers, and many of these are contract jobs, who have to be brought in to manage the dead animals. And they all have questions and concerns. And several of the questions in the chat are cutting right to the core of what information can they or are they provided with? And how up to date is it in a way that is relevant for what they're experiencing, which is sort of the leading edge often of these outbreaks, which require testing with delays, which require coordinated response and sharing of information across many of the organizations that Ben and others have mentioned. These are the workers who are facing it, in real time. And what we've learned is they feel like they're on their own. They basically, that's a theme. We are on our own. We often don't know how to protect ourselves. And if we get a message, it may be that, too late for us and their family members. And so we've been trying to think of ways, and I think many of the people on this call are trying to think of the ways to navigate these structural silos and gather information in a way that is cognizant of the threats to employment for workers if they speak out. Often there can be retaliation if questions of a certain health hazard variety are brought up from employers. And often there are challenges with jurisdiction of people who may have a different perspective, a different public health protection, a different precautionary perspective about the potential positive impact of the greater availability across a wider distribution of contract facilities of PPE, for example. And I think we heard from NCFH, Bethany, and others where it can be challenging to figure out how to get delivery of information and services, or it can be very challenging to try to collect, to try to make the measurements. In this case, there's big challenges with passive surveillance, passive testing structures through the National Influenza testing services, which have identified 1 out of the 20 current HPAI cases, but that's generally what just comes into hospitals and gets routinely tested. That's not thinking about, if you sit around a table in Duplin County or on the Eastern Shore, how do we get tests to workers who are afraid to speak up, who may be afraid to speak up, or may not know the evolving nature of the disease definition of signs and symptoms, which for this one, a very interesting one, I'll close with this anecdote, was I believe Meghan, Dr. Davis, and I, and others at Hopkins, Deanne Williams and Chris Spicer were on a call with a local healthcare provider of a community health clinic on the Eastern Shore of Maryland. And this healthcare provider at that time did not understand that ocular eye symptoms were a part of the HPAI disease presentation. And when we shared that information for her, she thanked us profusely because now as she thought back on the patients who were industrial poultry operation workers, she had several patients who had the eye and ocular symptoms. And she can start with that information. She as a healthcare provider can start thinking about, could it be related to the conditions inside the facility, temperature, chemical agent exposure, dusts, or could it be because of biological or viral exposures? And so this is a big challenge, I think, with the structural aspect of this is how do you get public health protective messages? We didn't, and I don't think, Ben, we've really talked about OSHA, Occupational Safety and Health Administration, or the National Institute for Occupational Safety and Health's role here. It's often that they find it difficult to identify where they have jurisdiction because there may be not sufficient number of employees at individual concentrated animal feeding operations to allow them to come in and start an official investigation. And I'll pause there, hand it off.
That's a great point. Thank you for flagging that. Anna, I have been looking forward to hearing from you and Carla. Please share with us about your work and what you have been experiencing supporting dairy workers.
Oh, well, I'm going to reinforce the comments of Bethany and also, what's your name? The last speaker?
Chris.
Chris. Because that's exactly what we're dealing with is the lack of information from the top to the workers. We started at the end of April by chance, we ran into someone from USDA, and he mentioned, are you taking precautions going to the dairies? And we had no idea, why he was even mentioning that. And he said, well, there's been a few herds of infected cows in northern Colorado at the dairy areas. So that was the first time, the end of April. And we started, my team, we're 5, I'm the director, but I also go out. We cover, there's around 70 dairies in Will County and around 10 dairies in Larimer County. But we started asking questions to the workers, and they had no clue. They had never heard. And we kept insisting, and the comments, these were comments from dairy workers from various areas. So we had patterns of information. Some of them said, yeah, cows are getting sick. And some of them said, yeah, cows are dying. And, these are anecdotal. So we have no proof, but it was just like maybe a dairy worker from southern Will County was telling us that, and then someone from Larimer County, they were saying the same thing. So it wasn't like they were making it up. There were patterns of answers. And at that time in May, no one was getting information or protective gear. Later on, we started asking questions about, is anybody getting sick? Do you know? And that brought a whole different issue about just general health and in the dairy work, in the agricultural, because it's well, yeah, we have been sick. We have had like the flu or gripe, that's what they say in Spanish. But we don't go. I said, well, what do? Do you go to the doctor? I said, no. He said, because it costs money. It costs money to go to the doctor. And then if we go to the doctor and we miss work one day, then we might not have a job. And those were anecdotal responses, not just from the same response all over the area. So there's fear of leaving the job and not get, for health reasons. So I feel like there is a lot more avian flu incidents, but no one knows about it because they don't go to the doctor and they don't get tested. But they were saying, yeah, we've had fever, we've had red eye, but we don't miss work. We just go to work. We buy, medicine over the counter when we take herbal teas and stuff, but we self-medicate. We don't go to the doctor. And I don't think there's been, in all those months that we've been doing outreach and taking protective gear and flyers and we haven't had one single person tell us that they've been to the doctor because they're sick. Because literally they say, we don't want to lose our jobs. And that was a real because it, like I said, it goes hand in hand with just the whole healthcare system in our country related to, what's going on with this outbreak, and part of our role as promotoras is to educate them about the rights. And so we also hand out information, like you do have rights, and if you're sick, you have a right to, miss work. A lot of that is just it's been a pattern all their lives that they don't want to miss work because that makes them weak. And that was one of another pattern was that we did get a lot of reports of cows dying, and not just from one area. And so, our dairy had about 40 cows that died. Oh, our dairy has, there's a huge dairy that has thousands of cows, and they said, oh yeah, we had about 200 cows die. And they were saying what were the symptoms, and I said, well, did they give you, we isolated the cows from the infected cows from the others. I said, well, did they give you information about what you should do to protect yourself? He said, no, they didn't. But we've been, he said, one person said, I have some relatives in Texas and they told me I should go out and buy some goggles. So he went out and bought himself some goggles. So, it's not all bad news about employers not telling the workers. There have been some dairies in the area that have stepped up to the plate and have given information, but there's just a handful. The majority have kept the workers in the dark. And so thanks to the funds that we get from NCFH, we also have High Plains Intermountain Center for Agricultural Health from the CSU, Colorado State, has also given us assistance, and they make copies for us of flyers, and they're doing some TikTok programs, and we've helped them, we've collaborated. But education and to the workers is, so important, because it's to empower them and to just let them know what's going on exactly, and just not all this misinformation that they're, like I said, they feel like they're the ones that are going to infect the cows by moving around and taking the, it's like it's their fault. It's not, the other way around.
Thank you so much, Anna. And I'd like to see if Carla has anything to add to
Carla is a unique case because she actually, her husband works at a dairy, and so she has firsthand experience of what, through this whole thing. She can share with you what she learned, what she has learned from the beginning. Carla.
Hola de nuevo. Pues sí, muchas cosas de las que dijo señora Ana son ciertas. Nosotros, yo lo que he escuchado de los trabajadores es que ellos están frustrados porque no reciben la información necesaria para poder protegerse. Muchos trabajadores me tocó de primera mano informarles porque ellos ni siquiera habían escuchado de lo que era la gripe aviar. Ellos pensaban que era una gripe normal. Entonces, al nosotros empezar a llevarles la información, ellos estaban muy confundidos porque se preguntaban por qué no recibían la información de sus empleadores, que eran los que principalmente deberían de estarlos capacitando, informando de cómo cuidarse. Por ejemplo, aquí mi esposo es trabajador de lechería, y a ellos ni siquiera hubo un brote que duró aproximadamente 7 semanas. Murieron aproximadamente 80 vacas de 5,000 que hay más o menos en la lechería. Y ellos ni siquiera recibieron instrucciones de, oye, protégete, a los trabajadores que trabajaban directamente con las vacas enfermas. No recibían cubrebocas, no recibían gogles para los ojos para protegerse. Ellos seguían trabajando como normalmente, o sea, era un caso más. Sí ordeñaban a las vacas aparte, a las enfermas, pero se vio disminución en su leche, o no daban nada de leche, bajaron de peso, se veían cansadas, con sus ojos rojos, ojos tristes. En otras regiones de trabajadores también me ha tocado ver que cuando les hemos estado informando, ellos se preguntaban por qué esto no lo pasaban por televisión, por radio, por qué se preguntaban por qué no estaban escuchando la información suficiente de cómo cuidarse. Ellos, muchos trabajadores se enteraron por nuestra organización. Entonces, se les hacía confuso para ellos porque nadie los estaba informando. Entonces, cuando empezaron a informarse, ellos empezaron a tomar un poco de miedo y de hecho había un trabajador que él decía que él tiene un bebé recién nacido en casa y le daba mucho miedo a llevarle el virus y llegaba a su casa de su mamá a bañarse, cambiarse y ya llegaba a su casa porque él tenía temor de enfermar a su hijo. Entonces, ¿por qué si él, que fue el único que escuché, por qué no todos hacían lo mismo? Porque no tenían la información suficiente. Las lecherías no les están informando, no les están diciendo, no los están capacitando cómo cuidarse, cómo protegerse del virus. Entonces, ellos, tuvimos una reunión con ellos hace unas semanas, entonces ellos, una de las... lo que pidieron ellos fue que les gustaría estar informados, que hubiera un instructor que les dijera, tienen que usar esto, tienen que usar protección, tienen que lavarse las manos, tienen que usar guantes cuando trabajen con vacas enfermas, tienen que cuidarse de no llevar el virus a la casa en caso de ustedes mismos enfermarse, y pues sí, de que ellos mismos no iban al médico porque tenían temor pues de perder sus trabajos en caso si se sentían enfermos, ellos tienen que seguir trabajando. Entonces, pues hay unos que sí están preocupados. ¿Cuáles? Los que están informados. Los que no están informados, pues ni siquiera ellos no saben qué hacer, no saben cómo cuidarse. Entonces, sí es un tema que me preocupa a mí, el que no los estén informando, no les estén diciendo cómo cuidarse. Entonces, es una manera en que podíamos también frenar un poco el virus, el mantenernos informados. Entonces, ahora que nosotros estamos llevando la información, los flyers, oye, yo no sabía que esto era como un virus, yo no sabía que me podía enfermar yo. Muchos pensaban que solamente las vacas eran las que se enfermaban. Muchos desconocían que se enfermaban las personas. Y como decían ahorita, no recuerdo quién, también se enfermaron, llegaron a ver pájaros muertos y gatos muertos en las lecherías. Entonces, sí me gustaría a mí que pues hubiera más información por parte de los empleadores, pero mientras a nosotros nos toca estar llevándoles la información y los recursos que ellos necesitan. Estamos entregando ahorita unos kits con lentes, con cubrebocas, con guantes, con face shields. Entonces, pienso yo que es muy importante seguir con la información para ellos, para que puedan protegerse a ellos mismos y a sus familias. Sí, es todo.
Wow, thank you so much, Carla and Anna, just for that firsthand perspective. We appreciate that so much. And this conversation should have probably been a full day of many different conversations because we're bringing up so much important information. I think I'd like to transition now just for a few minutes longer to hear maybe from each one of you before we go into Q&A. So we'll have to keep it a little bit brief, but from what we've discussed today, from your work, what are some potential opportunities, some potential actions that people can look for or consider? Chris, I think you framed this really well for us as we were discussing how to go about the discussion. Are we going to remain in this reactive, potentially failing status quo of a response? Or are we going to look at these different intersection points where it's impacting animal welfare, impacting wildlife, impacting local communities, impacting farmers, impacting food safety? Are we going to find ways and new paths forward so that we lessen the harm? So maybe I can just ask each of you to weigh in a little bit on opportunities that you're seeing. And I think I'll start back up with Meghan.
Great, thanks so much. And I'll defer in part to Bethany, I think, on the worker engagement piece, because I think that that is absolutely essential. When we should have engaged was a decade ago, or 5 years ago, or last year, right? Because building relationships after we have an outbreak is not the ideal way to go about making an introduction and making sure that what we have is not just communication from the federal government or the state to our producers and workers, but communication that is in both directions, where there is a lot of listening and a lot of understanding of what the challenges are. For example, it is difficult to work in a poultry barn in heat and humidity, right? And especially if you have your ventilation fans going at full bore, even if you are wearing your personal protective equipment, it might compromise the seal of the face mask. It could slip under your face shield. And so understanding that and maybe even thinking about how we can redesign some of our safety measures is, I think, a remarkable opportunity. Similarly, in a milking parlor or working in the sick cow pen, you may need to be doing things a little bit differently. It may not just be about the personal protective equipment, right? This could also be about the way we do our work and the kinds of breaks that we get so that we're not putting ourselves in compromising positions when we're on the farm. As far as kind of the larger system, I think a lot of my great colleagues here have talked about the silos. And we don't mean a grain silo, right? Where we store things. This is the way we separate our functions between the federal authorities and the state authorities and our producer decisions and the empowerment of our workforce. We also have silos between the human health sector, the animal health sector, what we do with wildlife, what we do with companion animals, what we do with stray cats on a farm, what we do in terms of the environment and how the virus might last in the environment for periods of time. And because of that, we don't have a very integrated approach. But this may be exactly the kind of case that we can use, and hopefully it doesn't get worse, right? I think that's our biggest fear, is that this could blossom into something even more severe if it becomes, as it might be doing, more deadly in the cows, if it becomes more problematic in our workers, if they start getting more sick than they are now. That's a huge concern. So we don't want that to happen. And so paying attention to the ways that we can integrate our understanding of how the system works, how people are being exposed, how cows are being exposed, how wild animals are being exposed, and then the ways that we can step in and stop those exposures from occurring is, I think, a real critical need that we have and we have to solve. Thanks.
Thank you. Bethany, what would you add?
I would add one, if you are interested in volunteering with a farm worker serving organization, there's a link in the chat of a database we have. It's kind of ongoing updates, but there's surprisingly few farm worker serving organizations, and they often do need extra support, and we'll take it. So, you know, like Project Protect, there's so many organizations doing really critical work on the ground. The other thing that I would encourage is, if you have any ins with dairy producers, especially, or even as a consumer with consumer groups, you know, I think there's a lot of fear from dairy producers that, oh, if I test my herd and consumers find out that there's, you know, the virus in the milk, that people won't drink the milk. Whereas really the opposite narrative should be true, which is that we want you to test the milk and make sure that the cows get healthy and the milk is good again before we drink it. So I think if there's more consumers voicing that narrative that, like, we want you to do this, that could be helpful, especially for some of those medium-sized producers.
Great points. Thank you. Craig, from your perspective, what do you see as some potential opportunities to slow this, change the current process? What are you thinking about?
I think it reminds me a lot of my own program, where we try to catch farmers upstream before they actually sign contracts. our reactive methods is very costly, taxpayer money wise, right? And it just and doing it in a reactive way, it becomes whack-a-mole, right? So it just seems proactive, and I don't have any answers but I'm sure there's some folks on this panel that have thought a lot more through than I have. Proactive seems much more effective and much more bang for the buck, and like the ounce of prevention is worth a pound of cure, old adage. So that's it from my perspective.
I know we've talked to Craig in the communities that we support about just the concentration of these facilities being permitted and how that in itself is a threat. And I don't know if you want to speak more to that. I don't want to put words in your mouth, but
And I deal mostly in poultry, and the unfettered explosion of poultry in North Carolina. We have, I think the last number I saw was 7,000 CAFOs in North Carolina. Correct me if I'm wrong, anybody, but we have a lot, and that's bad enough if it's spread out evenly from Manio to Murphy, but it's not. It's in Duplin County, it's in Sampson County, and it's in Robeson County where I'm at, and so I mean, it's just setting up the communities for. I mean, the metrics are already there. I mean, you can look at health metrics, you can look at unemployment, you can look at median income. It's this anchor that's dropped to the bottom of the boat that's carried us all to the bottom. And so the race to the bottom is where we're at.
thank you, Craig. Chris.
Yeah, I think building off of what Craig said, I mean, if you think about some of the preventative messages that exist from the federal agency responses, Ben and others mentioned, APHIS, you have mandatory calling if herds that are a specific distance apart, right, are to test positive. And there's also preventative calling decisions around HPAI. And within the context of North Carolina, where Craig mentioned this concentration of poultry, concentrated animal feeding operations, it's not just the density of the poultry operations. In North Carolina, there is a trend where the same contract grower who may have been for years growing contract hogs now can carry and pick up a contract to produce poultry, turkeys or broiler chickens. And so you've got co-location at a pretty substantial scale of herd sizes on a single property, and if you just think about some of the things we've been tracking in this HPAI outbreak that have been cause for concern among whether you're a veterinary health expert, a public health expert, occupational health, or otherwise, is the host jumping, seeing it jump from avian species into cattle. Another concern is seeing it jump into swine. That host in particular is uniquely well suited for those influenza viruses to reassort and acquire properties that are very beneficial for taking up residence in humans. So I think this is a big challenge, and one of the opportunities I think I see, and I'm not aware how much of this either because of the things that Anna or Carla mentioned, or it's maybe resource constraints, or maybe it's a fear in terms of perhaps some of the official responses being protective of the corporate product sales, but access to free testing, right? Access to what did we all have provided by the federal government during the pandemic response? Rapid tests, right? They have rapid flu tests. And one of the things that we think about that's a unique role that academics can play is to design ways to get access to testing services, but that are in a way that assure privacy and confidentiality, such the information can land into the workers or the producers' hands, but they can be protected and they can use that. And then we can also supplement it with interventions, PPE, or protective messages, right? And so that's something that we've been thinking a lot about is what role could we play across coalitions on here, the NC, the National Coalition for Farm Worker Health, et cetera. Can we try to identify and fill some of those gaps where we're not sure if testing availability is getting, or PPE is getting to the right workers in the right places, as we heard from people on the panel.
Great ideas. Thank you. And really quickly, I'll let Ben and Anna and Carla answer, and then we'll try to get to some Q&A. Got some good questions. If you're able, if panelists, if you're able to address some of these in the Q&A, that would be great. And then we'll see what we can get to live.
Chris, you have a great point there about having testing available, because our experience is that people, workers don't want to take the time off because either it costs money or they're afraid of losing their job. But if there was a place where they could have a test and it was free and confidential, it would solve that gap that exists right now.
Thank you. Ben?
Sure. Y'all have offered a lot of great solutions, so I'll be brief. I'll reiterate a point that Dr. Davis made about the interconnectedness of these problems and our need to resist breaking them down into silos. We at the center really do think that a sort of One Health perspective that views as interconnected human health, farm to animal health, environmental health is really necessary, and we would really push agencies to also adopt this approach to kind of break down the communicative barriers to get agencies to coordinate with each other better, share information better, to work better between their federal and local and state counterparts. We really will have to address this problem from every angle together in a coordinated way. And so, yeah, I'll reiterate the need for an interconnected understanding of this problem and a commensurately interconnected response.
And Ben, if there is a link that you could add to the chat about that One Health concept, or if there is kind of a place where folks are, pushing for that, or like language that they can use to start bringing that up more in whether political settings or agency settings, that would be great if you could share that. Carla, do you have any solutions?
Pues sería muy bueno lo que comentaban ahorita de los test gratuitos o que estén más accesibles a la comunidad. Y pues, no sé, hacer un llamado a las empleadores, porque hasta ahorita yo no he sabido, en mi área solamente hay 2 que los mantienen, que les han proporcionado con qué cuidarse. Entonces yo ya haría un llamado a quien se tenga que hacer para que les den la información en las lecherías, en las mismas lecherías, a sus trabajadores. Y pues yo creo que eso sería esencial, mantenerlos informados y proveerles los test para poder hacerse los test para ver si tienen el virus.
Thank you. Let's try to get to a couple of our questions. I see one that's kind of repeated a couple of times. Do we have any examples of some political leadership here, or any examples of legislators, congresspeople concerned about this issue and considering potential legislation or task force or groups? Any examples of that?
At the federal level?
Or even state, and local is a bit of a separate question. I'll get to that question if we have time. State or federal?
I'm aware of a bill that was introduced by Senator Cory Booker to prohibit the feeding of chicken litter to cattle, and that's been associated with some concern about spread of avian influenza between those species. So that's something that could be supported.
I think, go ahead, Megan.
Oh no, you go.
Well, I was gonna, I think it's a bit telling that this is an example I'm aware of, but it's not from the US, but it's perhaps an example of how we could coordinate across these silos. One is, and it harkens back to things Meghan, Dr. Davis said about, we should have been thinking 10 years ago, 15, because avian influenza and the structural issues, it's not the only hazard. We had antimicrobial resistance, right, which has been ongoing, and it has a human animal, one health. The arrow goes both ways, but there's also a strong reservoir in the kinds of intensive food animal production facilities. And Europe has coordinated across sectors. It's sort of in all of EU, all of European Union, best science from the clinical, the animal veterinary, and the public health. So that's one example around antimicrobial resistance, which has led to policy change to encourage reduced uses of antimicrobial drugs, right, in the production sector. And then the other is in Asia and China. Greg Gray, who's a researcher who started a lot of this awareness and science around the role of livestock workers in influenza. His arc of his career is 20 years ago. Until recently, he's found that he's having challenges doing this work in the United States, and has shared that he has had to go to other places in South Asia or China, where the governments would provide that protection, that economic protection for the producers, if the research questions of a One Health, environmental, occupational, public health perspective were to show information that could be potentially influencing consumer purchasing habits of a meat or a milk or other product. So I really think it's about thinking at a higher level about how do we make it possible to be responsive to the worker concerns who are under the pressure of the system. How do we alleviate that? And I think it really involves coordination above with a lot of government support, such that it won't create that pressure, that economic pressure on the system.
Yeah, and I'll just jump in and add that at the federal level in the United States, there is a certain degree of coordination. There is a One Health office within the Centers for Disease Control and Prevention that's tasked with some of this coordination. And you've seen them come together and do joint press releases and, have a lot of support and partnership with their states. And then each state is going to be a little bit different from each other in terms of their level of coordination. So I've chatted with some of the state veterinarians, state epidemiologists, other folks who are working at that level, and they have a lot of communication with kind of across these different silos and also across the different levels. But when this is done in a really ad hoc way, that it might change from one outbreak to the next, or that it might be a little bit different in one state from the other, some of that makes sense because the context may be different. But in other ways, we may be missing some opportunities to have these deeper connections on a day-to-day basis, not just for this particular outbreak. And with that, I agree with Chris. We have some models internationally where other countries are doing a lot more of this kind of engagement. And he mentioned Southeast Asia. I think Thailand's actually a great example where they really do bring the environment in a little more strongly than you see. And we also have some major gaps within our structures. For example, we have food animals who are housed under the United States Department of Agriculture, but where would you put a cat? Where would you put these wild birds? Where would you put horses? Where would you put some other species that might be really critical, like some of our marine mammals? And I think that gap in our surveillance systems means that we're not giving as much value or attention sort of all the way across. And that means we might also be missing some exposures to people who don't recognize, because we don't have the surveillance, that they could be on one of the pathways by which they could be exposed.
All great points, and that's making me wonder, like how potentially we could plug our various networks of advocates and engaged community members, farmers, into various types of advocacies or various types of appeals, conversations, meetings. So I know we're not getting to all of the questions exactly. There are some folks who got their questions answered, so thank you, panelists. There are some folks who we may follow up individually. Actually, for 30 seconds, sorry, something that we didn't address. Could we talk really quickly about risk to humans currently from this current state of the virus versus what we're concerned about? Because I think some folks are saying, I live a mile from a dairy. How concerned should I be about my own health? Could anyone speak to that just really quickly for us?
I'm going to defer to Bethany if she wants.
I think we just don't know the answer to those questions, and that's why it's hard. Obviously, if you're interfacing with folks who are inside of dairies or interfacing with animals, then that would be a concern, but otherwise we don't really know.
And one thing I'll mention that is a critical part, and I don't know if people remember this from the COVID pandemic, is that you've got the tests for the virus, right? Which are at the point when you're symptomatic and for a period thereafter. But if you miss that window, how do you get information about what might have been happening if a person was symptomatic for flu? So antibody tests are another way. And we've heard about this with the Missouri case, where there was no known exposure to livestock, right? But individuals who either were in the patient care network or in the person's social network were also contemporaneously experiencing symptoms that could have been similar. I think that's the big unknown, and I think many of us, the world, is also waiting to hear. As I understand, antibody testing is underway. So I think that's something that I think we heard Anna perhaps and Carla mention, of these symptoms of the eye variety and work. I think there's so much that is, if you don't test, you don't know. We don't know the extent of this. And with all of the structural barriers between these federal institutes and agencies, I think we are now at this point to really get a better understanding, to look back in time. Antibody testing would be one of the ways to be able to try to get a handle on the extent of this. I haven't heard of a sort of a coordinated, perhaps blood donor, like a Red Cross blood supply, but that is the way, or a national health and a nutritional examination survey way to try to get a sense of this. But that I don't, Bethany, other than better active surveillance for testing for the virus, I think we're going to have to answer that through antibody testing.
Okay, well, thank you all so much for your time, for your expertise, for all of the energy and thoughtfulness that you are bringing to this issue. This has been such a vibrant conversation, and I know I am leaving with more thoughts and questions. So I do want to encourage folks in the audience. First of all, if you are concerned about a livestock operation in your community, or just wondering how you can get some more help with more resources, please see our help hotline. SRAP is here and ready to assist you and connect you with resources. But I would also encourage you to follow each one of these panelists' work. I know Dr. Davis and Dr. Heaney are going to do a similar presentation next week, perhaps to a different maybe more academic audience, but kind of drilling down more into some more solutions. So please look them up, please follow their work, and also just feel free to connect with SRAP if you haven't already, and we do hope to kind of continue this conversation, and when those advocacy discussion, action opportunities come up, we would very much like to connect you to those. So with that, I'll say thank you so very much for joining us. Thank you to our guests, and we hope you have a great afternoon.